this is actually one of my favorite slides. I shamelessly stole this from a good friend of mine, Dr. Brzezinski. And just to put things in perspective, and I will tell you, so my mother is an economist, and I remember talking to her and just describing how like the procedure, like how the procedures in medicine don't necessarily are not all successful, and yet we do them anyway. So she was like, "What do you mean?" I'm like, so I'm like, how many patients do you think you need to give aspirin to for a patient to benefit? And her answer was every single patient. Like, why would you give me a medicine that's not going to work? I was like, well, that's not how medicine works. Like, I can give like a large number of patients aspirin, but not all of them are going to benefit. So that actually wanted me to put it made me decide that I wanted to put this in perspective. So we came up with this approach to essentially figure out like how does mechanical thrombectomy compare to other interventions in medicine? So bariatric surgery. So Devin, I'm sorry, I don't mean to put you on the spot, but you see the number here. So you need to treat 80 patients with 80 patients need to undergo bariatric surgery for one patient to definitively lose weight at 1 year. Okay. How about aspirin for myocardial infarction? How many patients do I need to give aspirin to to save one person's life?
Does it have to stay in this range that you have at the bottom, like 0 to 80?
Yeah, within that range. Well, not necessarily, but you have a patient with an MI, has a hemorrhage on the brain, just as an example, and cardiology comes by and says, you need to start the patient on aspirin. I'm like, yeah, but the patient's got a hemorrhage on the brain. And it's almost blasphemy. Like, how dare you guys not start aspirin on this patient? And what do you think is how many patients do you need to give aspirin to for one patient to benefit?
I don't know. I would say 100.
Oh man, that's
less.
That's a lot. Well, it's around 50 patients. That's still a lot. You have to treat aspirin to 50 patients for one patient to benefit. So then I think it's important to know this, because then when somebody comes and says, oh, we need to start aspirin, you can ask yourself, like, is this really going to be is this really what's going to help this patient? Or am I just putting this patient unnecessarily at risk? How about PCI for myocardial infarction? How many patients with a STEMI, like a blockage in a coronary artery in the heart, how many patients need to undergo PCI, or cardiac catheterization and removal and cardiac stenting for one patient to benefit? Mike, what do you think?
I'd say maybe 30.
Yeah, you're actually close. It's almost 20. But if you think about it, cardiologists, they have their own parking spots, like for emergencies. Like, I don't have my own parking spot for thrombectomy, yet they have a number needed to treat of 20. I joke with my cardiology colleagues all the time about this. How about sepsis for early goal-directed therapy? How many patients coming into the ED with sepsis do I need to give them IV fluids, start them on antibiotics, and maybe pressors to save their lives? And I think you're getting the sense of this. It's actually getting better. So it's around 8. So 8 patients need to undergo these therapies to save their lives, which is not terrible. How about permethrin for lice? You got children with lice. How many children with lice do you need to give permethrin to cure them of lice? I don't know if I can call on anyone else. I see Kyle Zappi. How many kids will I have to treat with permethrin for one child to be cured of lice?
I'm going to say 5.
Yeah, you're right. It's around 6. Permethrin for lice is better than PCI for myocardial infarction. Again, I mentioned this to all my cardiology colleagues. I'm like, guys, permethrin is better than what you guys do. DFib for ventricular fibrillation. So a patient comes in VFib and you shock them. How many patients do I need to shock to bring one person back to normal sinus rhythm? What do you guys think? It's getting better, right? You're getting the trend here. It's actually 3. How many patients, now this is the final question, how many patients do I need to treat with mechanical thrombectomy for one patient to have a good quality of life? We're not talking about mortality here. We're talking about an improvement in the quality of life.
1.
It's not that good. It's around 2.3. So but it's still better than almost anything you have in medicine. So I actually published this paper with Dr. Gupta, Dr. Sidori Chowdhury, and a bunch of my colleagues at Robert Wood Johnson before I moved to Westchester on the dawn of new era. And the centerfold of this article, this manuscript, is essentially every single procedure that we do in medicine with the number needed to treat, from antibiotics for acute bronchitis, the vast majority of which are viral, to mechanical thrombectomy, to sepsis, to bariatric surgery, to basically everything we actually just covered.
Hey everyone, Ryan Rad here from neurosurgerytraining.org. If you like that video, subscribe and donate to keep our content available for medical students across the world.